So hi everyone, we'll be looking at a tiny triangle today. It's a very tiny triangle. If you miss the vein here, your patient will cry. If you miss this topic, you will cry in exam. So better not miss it. So this tiny triangle is nothing but your cubital fossa. This tiny triangle is your cubital fossa. Okay. First, know the boundaries of cubital fossa. Coming to the first part. You see this muscle? This is your brachioradialis. Brachioradialis muscle. Don't mind the handwriting, we'll see it again in the drawing. So this muscle is your pronator teres. So these are forming the boundaries. This is not enough. You first know what is medial and lateral. Towards the body is medial, away from the body is lateral. If you don't know this part, I don't know in which condition you are in. Never mind, but yeah, don't worry. So coming to this muscle, only this muscle. This is brachioradialis, right? What is the medial part of brachioradialis? This one, no. This is the medial side, right? This is the lateral, right? So medial part of the brachioradialis is forming a lateral this thing of your cubital fossa. Didn't understand? Okay. Let's say I'm drawing your cubital fossa. This is your lateral part of cubital fossa, medial part of cubital fossa. Okay. Now, this is brachioradialis muscle. For this muscle, this is going to be medial. This is going to be lateral. Understanding? No. If not, watch again. Okay. So, this medial part of your brachioradialis is forming a lateral part of the cubital fossa. And then, what is the medial part of cubital fossa? This is pronator teres. This is lateral. This is medial. This is lateral. This is medial. So lateral part of the pronator teres is forming your medial border of the cubital fossa. If you're not understanding, watch again. So that's how the boundaries are formed. The joining of the two muscles is known as apex. Which two muscles? Brachioradialis and pronator teres, not biceps or triceps. So these two muscles joining part is your apex. Base is your imaginary line. It's present at the end of the humerus bone. That's your imaginary line. These are the boundaries. If you still didn't understand, don't worry. There's again a drawing part in that you'll understand. Even then you don't understand, watch it 10 times and go for your exam. So we'll go to the contents. So I was talking about a vein, right? This is the median cubital vein. If you don't puncture this correctly during IV, then you're gone case. So you have to be really careful. That's why study this topic carefully, please. So now let's look at the contents. The mnemonic is, so it's MBBS, remember. So what is M? It's median nerve. So you see this median nerve? So that's your first content. This MBBS is from medial to lateral. So median nerve, and then you have your B is your brachial artery, and then B is your biceps tendon. So biceps tendon, and then S. For S, you have to remove this biceps brachialis. You remove. S is superficial branch of your radial nerve. Superficial branch of radial nerve. So these are the four contents. So you are done with the contents and boundaries which you have seen in the 3D. Let's go to the pen and paper. There I'll explain you how to draw in exam. So peacefully you can draw that in an exam and you can peacefully write this topic without any doubt.
The easy diagram, you can use this in exam. It's taken from Vishram Singh itself. So first what you have to draw is you just draw the tail of the humerus, the reference for the imaginary line and everything. That's all, and just put an imaginary line around it. Now draw your brachioradialis muscle. This muscle is your brachioradialis, what I'm drawing. Your brachioradialis. This is your lateral side. Let's just name this. This is your medial. This is your lateral side. Don't get confused. And then on the medial side, from the common flexor origin, draw your pronator teres muscle. You're done with the boundaries of the cubital fossa. So this is your brachioradialis muscle. This is your brachioradialis muscle. Radialis muscle. This is your pronator teres. You see this part? This is your cubital fossa. So this is your cubital fossa. On the lateral side, you have your medial border of the brachioradialis. So this is your medial border, right? This is your medial border. This is your lateral border. And here, this is your lateral border. This is your medial border. So on the lateral side, you have a medial border of your brachioradialis. On the medial side, you have your lateral border of pronata teres. That's all. Simple. You're done with your lateral and medial. Base. This is base. Base is your imaginary line. Is your base. Okay. And floor is formed by two muscles. We'll see that in the next page. So just remember, floor is by your brachialis and supinator. Below this, you have your brachialis muscle and supinator muscle also. Now coming to the roof, it's formed by deep fascia. It has your bicipital aponeurosis, and it has your, okay, so that's how the roof is formed. Coming to the contents, it's very important. Coming to the contents now, there is a mnemonic for the contents. It is MBBS. Now what is MBBS? First one is median nerve. Median nerve. Second one is brachial artery. Brachial artery. Third one is biceps tendon. Okay, biceps tendon. And fourth one is superficial branch of radial nerve. Superficial branch of radial nerve. So these are your contents. So let's use orange for the nerve because yellow is not visible much in the video. So this is your median nerve. And then coming your brachial artery. Your brachial artery then divides into your two branches, ulnar and radial artery. This is your brachial artery. Brachial artery. Then coming your biceps tendon muscle. Let's say this is your biceps muscle. And this is your biceps tendon muscle. So I can use a green color for this to represent the tendon. So this is your biceps tendon. Biceps tendon. Then you have your superficial branch of radial nerve. This is your superficial branch of your radial nerve. You're done with the contents of the cubital fossa. Radial nerve. So this is your contents. MBBS is the mnemonic. So remember. So this is your boundaries you have seen. So as you have seen, the lateral border is from your medial border of the brachioradialis. The medial border is from your lateral border of the pronata teres. That's, and then base. This is your base. Base is formed by your imaginary line. This is called your base. This is your imaginary line. That's your base. And your floor is formed by two muscles. That's by your floor is by your two muscles. That is your brachialis and supinator. Brachialis and supinator. So this is your floor. So done with your cubital fossa diagram. This is how we should represent in the exam and write some points neatly represent in the exam.